Welcome to the Guide to Wellness podcast, your source for practical insights and tools bridging the wisdom of traditional Chinese medicine with the advancements of modern functional medicine, empowering you to live a life of wellness. We're dedicated to promoting a healthier world by providing tools, knowledge, and simple things you can do every day. So if you're ready to adopt new health habits and do things differently, then listen and learn here. And if you enjoy what you hear, please share this podcast, leave a review, and follow us for more health and well-being tips. Thanks, everyone. Hi, everyone. My name is Susannah Freeman, founder of Guide to Wellness and licensed acupuncturist. I'm here today to share with you some things I've learned along the way, so if you're wondering about or struggling with perimenopause, please keep listening. I began my studies of nutrition, mindfulness, and movement and natural medicine at an early age, around about 19, and really have continued it as my profession and my lifestyle since. These days I'm a practitioner of functional nutrition and traditional Chinese medicine, and one of the best parts of my job is to help make people's lives better. This podcast is one way we can share and teach, so if you find something useful, please give us a review, share this podcast with somebody you think might benefit, and tune in to future episodes. This is a whole series on menopause and perimenopause. Today, we're focused on practical, integrative solutions for managing symptoms of perimenopause using functional medicine and traditional Chinese medicine principles. We'll explore perimenopause through each of the 5 pillars of health. And I promise to leave you with a few things you can do right away to start feeling better. We'll give you practical tips in each of the 5 pillars of health and with more details in the show notes, so make sure you check these out as well. And you'll also receive an invitation to work with us directly for care that's guided by your individual needs and your clinical presentation. So let's get started. I want to do a quick recap of the perimenopause episode. If you haven't heard this one yet, please go to our website, www.guidetowellness.com, or your favorite podcast player, and search for the Guide to Wellness podcast. It's episode 19. We discussed symptoms of perimenopause and what's happening beneath these symptoms, maybe mood swings, hot flashes, fatigue, sleep issues, or weight changes. Sound familiar? We want you to understand hormone fluctuations and the importance of personalized care through lab testing and clinical assessment. We want you to know it's a transition, not a disease, and super manageable if you have the right tools and the right information. Today, and for the next few episodes, we'll be expanding on solutions, particularly from a functional and a traditional Chinese medicine perspective. We want to support hormone balance naturally. So as we get started, I want you to understand a little bit better what we mean by traditional Chinese medicine and patterns. So let's broadly understand traditional Chinese medicine for a bit longer. This is what we call TCM, stands for Traditional Chinese Medicine. There are many different lineages, but this is the one that really works with the Chinese herbs the best and provides the structure for our conversation. How do we diagnose and treat your symptoms? So we identify and treat patterns. First, we look for the root cause or the underlying pattern that leads to these symptoms. And this will in turn lead to your diagnosis in TCM. We may include labs and a diagnosis from your doctor if this is available, but it may not be necessary. It depends on the situation. Second, we'll prescribe a treatment for this pattern, and this will include herbal medicine, acupuncture, nutrition, and lifestyle suggestions. There is no single remedy. As practitioners of TCM, we focus on personalized care. Everyone has an individual pattern that leads to their symptoms. While we have a 2,000-plus-year-old lineage with science, protocols, and guidelines, we still diagnose and treat you individually, and we're using that wisdom of traditional Chinese medicine, and then we're adding to it the advancements of modern biomedicine. If at any time we need a referral to your doctor, we'll do this, and then we'll continue to collaborate as we recommend safe herbs, nutrition, and lifestyle tips to improve your well-being. So we're putting the two together and we're collaborating. And please remember, you'll hear me using these names of organ systems and patterns associated with traditional Chinese medicine. And while they may correspond to a biomedical condition in that organ, they often are reflecting a subclinical pattern of symptoms and not a disease. For example, liver qi stagnation is a pattern, and it may not reflect an underlying disease state in the liver. It's possible, but most of the time, women with PMS and liver qi stagnation do not have anything close to a liver disease. We're talking about patterns that are subclinical. Okay, let's use an example. A 42-year-old woman comes in to the clinic with increasing PMS, brain fog, and night sweats before her period. She's less tolerant, a little more irritable with her kids and her husband than she used to be. Her periods are getting heavier, and she's just feeling less sparky and a little more dull, not just in her body, but also in her mind, less sharp. And while she's unhappy with how she feels, her annual labs look great, according to her doctor, and there are no medical concerns. So her doctor will likely say it's normal and encourage her to get more exercise. And she agrees, and so do I. But still, she worries that something's off. These are true statements, and there's more she can do. Let's go ahead and diagnose this woman, theoretically, with a functional and traditional Chinese medicine lens. First, we'll identify the underlying pattern leading to the symptoms. And remember, there's likely no disease state in the biomedical liver. There may be an excess of estrogen or a relative deficiency of progesterone, or there may be dysbiosis in gut bacteria leading to poor detoxification of estrogens. On top of this, there may be elevated cortisols at night, leading to poor sleep and fatigue in the morning. Sound familiar? She's a good candidate for a more thorough clinical assessment and possibly some labs. We can learn a lot from more detailed blood chemistry panels, or even just an annual wellness panel read with attention to detail. Those lines of markers will tell us a lot about what's going on in the body. We will often use a narrower range of optimal on a lab when we're using the functional medicine lens. In this case, I'll want to see this woman's iron and ferritin and may ask her doctor to run these simple labs to rule it out. While her iron and ferritin might be in standard range, are they lower than optimal? And are they contributing to her fatigue and difficulty sleeping and concentrating? Are they why she's less sparky? Does she have a pale tongue, maybe? Pale skin, brittle nails, something called heart palpitations, which is just feeling your heart beating, or other clinical signs of blood deficiency? I'm immediately wondering, this woman may have liver qi stagnation with an underlying blood deficiency pattern. She also may have a longer-term tendency to heart and spleen qi and blood deficiency that has worsened with the demands of parenting and a full-time job. Now remember, there's nothing wrong with her heart or her spleen. These are patterns. It's easy to treat these patterns with herbs and nutrition, and not only will it make a big difference in her life now, it'll also make her menopause years easier. So in this woman's case, I would identify and treat her patterns for 3 months or so using herbal medicine, specific foods, and supplements to build blood, reduce tension during the premenstrual phase, regulate her mood, support her sleep, and above all, support her mental focus. We would guide her in mindset, meditation, timing of meals and exercise, how to regulate cortisols in the vagus nerve, so she has more control over her stress response and more control over her blood sugar and her energy. I might give her one herbal formula for the first half of her cycle, like Women's Precious or the Chinese name Bajian Tang with qi and blood nourishing herbs, and then maybe another formula after ovulation like Free and Easy Wanderer called Xiaoya Wan. This will smooth out the symptoms of PMS, irritability, breast tenderness, night sweats, and disrupted sleep. Then even better, if she can come in for acupuncture, we'll keep an eye on her, adjust her herbs, keep her hormones balanced, and make sure that her sense of well-being is improved and doing well. So meanwhile, she'll have specific foods to increase and others to decrease, along with recommendations on when to eat, when to exercise, and how to optimize her energy. We'll give her simple and effective exercises for breathing and promoting vagus nerve regulation when she's stressed. and we'll chat about her budget of time, energy, and money to make sure our guidance fits into her daily life. Most women who are wondering about perimenopause are also juggling lots of roles, and this is part of the balancing act. They have jobs, kids, partners, coworkers, aging parents, and they're often yearning for deeply connected relationships and a spiritual life. That's a lot. I want that too. I agree. We want all these things in our lives, and it can be a lot to fit in. And none of these are worth compromising. So when we're pulled in many directions for long enough, stress patterns begin to show up, and it's important to find time during your day to pause, breathe, fill yourself up. There's lots of ways to do that. One example is another episode on our podcast relating to the vagus nerve. Our clinic partner, Jack Schwem, teaches Qigong classes, and when you attend, he will show you how to take 5 to 10 minutes to restore your focus and energy in the middle of your day. This will help you balance out liver-qi stagnation. So this is a common diagnosis in TCM to describe tension in the body and mind. Don't worry too much about the term liver-qi stagnation. It comes from stress, lack of sleep, irregular diet, lack of exercise, or hormone imbalances. And while it's not fun and can be really uncomfortable, it's not a disease. And it responds really well to the 5 pillars of eating well, supporting liver detoxification pathways with nutrition, exercising and sleeping regularly, and spending time each day in some form of meditation, mindset, or prayer practice. And get a few hugs and share some laughs. The problem with liver-qi stagnation is that it makes perimenopause and menopause worse. So if you remember anything from this episode, please, it's to take care of how your liver processes and regulates. Do it now, and you'll be happy both now and later. So, to sum up, when you're in perimenopause, those years before you stop your regular cycle, first thing you want to do is support the TCM liver system. Second, you want to pay attention to the TCM kidney adrenal system. That's your stress response and your long-term energy system, and how to support that with sleep, exercise, diet, and nutrition. So this emphasis is going to flip-flop in the menopause years when supporting the kidney and adrenal system is going to become key, and the liver system will take a little bit of a backdrop. Now let's go over some common TCM patterns that we see causing symptoms during perimenopause so we can continue the conversation. You'll be a little better educated. Liver-qi stagnation, like I said, is the most common. These symptoms may be PMS, mood swings, sleep disruption, tension in the muscles, mood, and digestion like irritable bowel syndrome, maybe some weight gain. When any symptom, especially night sweats, occurs only during the PMS phase of the menstrual cycle, we'll consider this pattern. Next one is blood stagnation. This is poor circulation of blood leading to pain, especially menstrual cramping, joint pain, or muscle tension. You could have blood stagnation anywhere in the body, but in this case, we're talking about more the menstrual cycle. Another pattern could be liver blood deficiency, like the example I used earlier. This pattern can be associated with iron deficiency anemia, and other symptoms are like fatigue and poor concentration and brain fog, maybe some irregular cycles. Another one we see a lot is spleen qi deficiency. Nothing wrong with your spleen. And this can come with or without dampness, like a sponge that's full of water and needs to get wrung out. That fluid accumulation in the body. So this pattern has digestive symptoms like bloating and water retention, and it also has fatigue. This might be somebody who tends to worry and overthink. This could also be a person who has a heart and blood deficiency pattern as well, with heart palpitations or a tendency to anxiety and insomnia. Nothing wrong with the heart. It's just how is the mind calming into the body. Another pattern is liver and kidney yin deficiency. Now this one more directly leads to symptoms in menopause and can be more complicated when it shows up in a younger woman. So this pattern may look like perimenopause or menopause symptoms at a younger age than we expect. night sweats and hot flashes, disturbed sleep, fatigue, and weight gain happening all month. In this pattern, we can start with herbs and nutrition that fit your symptoms. But if you're really not responding quickly, we're going to recommend some lab hormone testing to better understand estrogen, progesterone, testosterone, DHEA, and pregnenolone, and that will tailor our herbal recommendations for you. So this is one that will likely pull in your doctor a little sooner rather than later. It's still not a problem. It's just that the labs will help us understand how to prescribe our herbs and nutrition better. Many of these patterns are going to overlap or show up together, making diagnosis the art of medicine and reminding us that people are individuals. So we treat the pattern from multiple angles. And we call this the 5 pillars of health. Here are the 5 pillars or foundations of health that I promised you we'd speak to. Number 1 is digestion and detoxification. Functional nutrition emphasizes the importance of a healthy gut for hormone balance. In TCM, digestion is tied to the earth element responsible for grounding and nourishing the body. A diet rich in fiber, leafy greens, and detoxifying herbs helps support the liver's role in processing hormones, which can relieve common perimenopausal symptoms like bloating and weight gain. And it's sometimes not that simple. So let's get into the weeds with a few examples of how that might play out in somebody's body. For example, in the gut, beta-glucuronidase is an enzyme. It's produced by gut bacteria that breaks down various compounds in the body and allows them to be reabsorbed. If the compound is estrogen that's bound for excretion and shouldn't be reabsorbed, this can lead to an unfavorable recycling of that estrogen. In other cases, that recycling can be a good thing, so it's very specific to the compound. High levels of beta-glucuronidase might inhibit phase 2 liver detoxification pathways, and especially the glucuronidation pathway. So in clinic, when we identify this, we often have success with balancing the hormones when we give these women a specific supplement called calcium D-glucarate, along with gut repair herbs and diet strategies. So simple, and yet it can really improve a pattern of liver qi stagnation with signs of estrogen dominance. So we need some of this information, and we need to make sure we're personalizing it to you. And so you're thinking, how does diet really make a difference with hormone balance? And what I want you to know is that nutrition really does play a critical role in hormone balance. Let's look, for example, at histamine-rich foods. This is just one little example that might make a difference for you. Research studies have shown that women during their premenstrual phase have increased sensitivity to histamine-rich foods. And more, painful menstruation, like cramps, might be associated with increased sensitivity to histamines. So please check out the show notes for a link to the study, and also you'll find a handout on the show notes that tells you what histamine-rich foods are. Gals, try this before your next period to the extent you can. I want you to try limiting or avoiding altogether histamine-rich foods. This doesn't mean you have a diagnosable histamine tolerance, but could it be that reducing histamine-rich foods before your period is a really simple, effective way to help ease those symptoms with nutrition? Pretty interesting, huh? All right, so we've talked a lot already about nutrition. The second pillar is functional nutrition. Here's a bit more. We've all heard about phytoestrogens. So consuming nutrient-dense, anti-inflammatory foods like phytoestrogen-rich plants like soy and flax seeds, but also anti-inflammatory foods like omega-3 fatty acids and leafy greens, they all help to regulate estrogen and support overall hormonal balance. Phytoestrogens do not actually add estrogen. They modulate it at the level of the cellular receptors. So fermented soy, flax seeds can be balancing. Now there's other foods and herbs that actually increase estrogen, and those you may need to be careful with. If you know you're low in estrogen, try more hops. You can get that in an extract, or you can get the hop water at the grocery store that's non-alcoholic. So this is not beer, this is hops and sparkling water. And it's really yummy, and it's great for a Sunday afternoon picnic. So there's just a few foods that you could try to just build and balance that estrogen. If you are high in estrogen, you might not want to do the hop water, for example. So knowing your levels will really help. If you know you're liver blood deficient, we want you to eat iron-rich foods, grass-fed meat, especially the red meat, eggs, black beans and lentils, and dark green leafy vegetables of all sorts. Beets, and especially beet greens, are also really good at building blood. What if you're spleen Qi deficient? Please take vitamin D and make sure you're taking a really nice high-quality B vitamin, especially with B12 and folate, and try to do these with your first meal of the day. They'll give you energy. They'll support your liver, detoxification pathways, and as well, they're going to build dopamine pathways that give you more energy and motivation for the day. Focus on easy-to-digest foods, whole grains, root vegetables, soups, lightly steamed vegetables, and try not to eat too many cold and raw foods and ice water when you're eating, as those can leave you feeling bloated. Well, what if you have blood stagnation? So remember, this is the poor circulation and inflammation often in the muscles and the body. Try increasing your fish oils and overall omega-3 fatty acids. These are going to move and thin the blood and promote healthy circulation. And do remember, if you're taking any blood thinning medications, be really careful with these recommendations, because fish oils, for example, can actually thin the blood more than you want if you're on blood thinning medication as well. We want you to eat clean fats and organic meats and poultry whenever you can. Foods that lower inflammation will be good for you, and we can give you more guidance on this when we know your particular needs. Fasting is not a pattern, but it's a really important topic to pull in here with nutrition. It's been a really popular topic recently, and a few people are actually tying it into the menstrual cycle and perimenopause. So one example is Mindy Pelz, who wrote a book, Fast Like a Girl, and it's all about time-restricted eating or intermittent fasting that's focused on the menstrual cycle. So many of our patients have benefited from this strategy, but please remember, if you have a thyroid imbalance, gallbladder dysfunction, difficulty digesting fats, hypoglycemia or low blood sugar, or even just low body weight, we don't recommend that you overnight fast more than 12 or 14 hours. Even that might be too much for you. So we're happy to help guide you to a more suitable time frame. Just keep these in mind. We don't want you stressed if you're fasting. So please be careful with that. And we do have a podcast episode on fasting. If you search back earlier this year, you'll find it. Pillar number 3, hormone and metabolic health. When we think about hormones and metabolic health in perimenopause, we consider estrogen, progesterone, testosterone, with DHEA and pregnenolone as precursors. Your body makes all of these. We often test these labs. Think of them all together as dance partners that need to act in an orchestrated way. And just as important is the dance with cortisols, melatonin, insulin, and thyroid hormones, just to name a few. Each of these topics is its own conversation, and we have this conversation with you and your doctor to order those labs and to help interpret them in your case. So remember, you are this integrated system of biochemical signals. And if one part of the system is high or low, or the signals are misfiring, it's going to affect the whole system. And that's the beauty of traditional Chinese medicine and functional medicine. We're looking at the system and how all of those signals are in a dance and they're supporting each other. And if you tug on one, it's going to affect the other. Okay? So here are the main hormones we consider when supporting a woman in perimenopause. Thyroid, Do you have signs or symptoms of high or low functioning thyroid? And we can help assess this with clinical exams, assessments, and labs. This is something we do a lot of. Once again, the liver and nutrition is the first thing we're going to recommend if we suspect a thyroid imbalance. Start easy with nutrition. Did you know that a small handful of Brazil nuts each day provides selenium that helps the body convert the stored thyroid hormone T4 into the active thyroid hormone T3? And more importantly, a well-regulated liver system will also convert T4 into T3, giving you more energy and a healthy immune system. So once again, knowing your body and whether or not thyroid is part of what you need to support is going to help you and us. It's going to help us understand what your nutritional priorities should be. Let's chat about cortisols. These hormones from the adrenal gland may get prioritized when we're under stress, and that's going to leave less resources to feed into estrogen and progesterone pathways. This is a really complex topic, but we can give you a few general tips here. If you feel stressed, you may have elevated cortisols in that moment. Take 5 minutes to breathe, focusing on the exhale. Get outside and move. Drink water. We have 2 fabulous podcast episodes for help with stress in the moment. The first is episode number 11 on how to breathe for energy or for relaxation. The second episode is number 15, and this is how to use your voice to relax the vagus nerve and calm your body. They're both super worthwhile, so we encourage you to go back and listen. If you have elevated cortisols, we could try a simple herb like ashwagandha to gently calm down the body, especially those excess cortisols. And it's not stimulating or sedating. It's generally very well tolerated. If you have elevated cortisols and are also kidney yin deficient, then rhodiola or licorice root might be a nice tonic in the evenings and in the mornings. If you have irregular blood pressure, please be careful with these, or come see us and we'll help you. It's important to wind down at night and turn off your screen an hour before bed and relax into some sleep. If you need more help with sleep, come see us also for an herb consultation and we can help give you specific guidance. Well, what if you have low cortisols, especially in the mornings, and you're not necessarily stressed, but you're tired, and you might also have what we call spleen deficiency? So then Bacopa and a carefully dosed Siberian or American ginseng can really help you focus better during your workday. You can replace caffeine with these adaptogenic herbs. And remember, like I said before, vitamins D, B complex, and especially B12 and folate are really important if you have spleen deficiency. How about insulin? This is a hormone from the pancreas, and it's another major dance partner. It works directly with cortisols and indirectly with estrogen, progesterone, and testosterone. We'll do another podcast episode soon on blood sugar, so stay tuned to that. So we know that many symptoms of perimenopause relate to stress, fatigue, and sleep. When we stabilize blood sugar, our energy, sleep, and well-being improve. While balancing blood sugar may not directly influence estrogen and progesterone levels, it will help you feel better. And then you'll have a better chance of making really good decisions about your health, and that's what matters. The best thing you can do for balancing blood sugar is to be really intelligent with simple carbohydrates and focus more on nutrient-dense carbs and low sugars. Fill your plate with colorful, fresh vegetables first, and then add adequate protein, and lastly, add a small carb in a smaller portion. Eat those proteins and veggies first. You'll still get to eat everything. It's the amount and the timing that matters as much as what and how much you eat. And remember, stress is really important with blood sugar. So keep that in mind. Get your exercise. Let's talk now about Pillar 4. Pillar 4 is rest and movement. Here we're going to talk about the yin and the yang of rest and movement. Yin in Chinese medicine is that restorative, gentle, nourishing sleep and rest. Yang in the Chinese medicine system is active metabolic energy, strengthening exercise and activity. So we need both in balance. And depending on your pattern of balance, as you move through perimenopause, we'll be recommending different strategies. Both yin and yang emphasize balance and regular movement that doesn't overly strain the body, and restful sleep that aids hormones and metabolic health. So exercise and rest is essential for anyone with liver qi stagnation. When you feel revved up and tense, go out and move. If you're tired, we want you to rest, meditate, journal, or do some restorative yoga or qigong. Try not to drink caffeine after lunch. That will really help. Well, what if you have liver blood stagnation? Then we're going to really recommend movement. Move your body. You want to promote circulation. And of course, you also want to avoid injury, so don't go crazy. The best time to exercise like this is when your cortisols are high and you feel wound up. If you're more blood and qi deficient and maybe feeling tired or weak, then yoga or qigong will gently move qi and blood circulation. So listen to your body and you'll know what to do. What if you're inflamed in a certain area and you need gentle circulation, like the gut or the liver? We'll often recommend a castor oil pack or a ginger compress. This is really nice for menstrual cramps or sluggish digestion, and we can guide you on this if you like. Also check out the show notes. We have some handouts for this. So what if, again, you're more kidney yin deficient? You don't want to overdo exercise. Keep it to your tolerance and so you can easily recover within a day. Please stay hydrated and get enough electrolytes. Eat potassium-rich foods. We have a handout for you on the portal for this. Focus on activities that promote quality sleep and rest. And again, restorative yoga and qigong are super helpful. What about rest and movement as it relates to hormones, you're wondering? So let's chat again about cortisols from the adrenal glands. We want them at a high level when the sun is up and a low level when the sun is down. Melatonin from the pineal gland is the opposite. If you're out of balance, the best way to reset your cortisol levels and circadian rhythms is to make sure you get to bed by 10 or so and wake up with the sun. Sometimes that's hard to do, but it's really, really important and you will benefit. Get sunshine into your eyes, outside as early in the day as you can. If you can exercise during this time, that's even better. But just enjoying a cup of tea or coffee on your porch in the morning sun will help you be more productive during your workday. And this simple thing will set your body clock to get sleepy at a reasonable time later that night. There's actually science that shows this. And remember, those vitamin D and B vitamins with your first meal of the day will also help you reset. By evening, cortisol levels should be dropping. If yours are high, consider high-intensity cardio, exercise, before dinner to bring them down, even 10 minutes. If you're low in cortisols, then be careful because this will lower them further. As I said earlier, you may want to do restorative yoga or just go for a quiet walk to gently move your body instead if those cortisols are low. Pillar 5. Brain health and well-being. So this is the fifth and the final pillar, and it's the most important. We save it for last because each of the pillars that came before will support and improve brain health, cognition, mood, and focus. Still, there are specific strategies here we want to prioritize. Cognitive changes such as brain fog or forgetfulness are super common in perimenopause. A woman can feel she doesn't know herself anymore. And we can help with this and remind her that it's not a sign of old age, it's a sign of metabolic and hormonal imbalance. So we'll recommend nutrients like omega-3s and B vitamins to support specific neurotransmitters, whether it's dopamine or serotonin or GABA or acetylcholine. If deficient, we'll nourish the blood and qi with herbs and nutrition. If you have liver qi stagnation, we'll calm irritability and anxiety. We'll help you balance your blood sugar. It's everything we've talked about already, and this time our focus is on mood and brain health. In addition to specific nutrition and herbal formulas, acupuncture is a great tool for balancing the mood, calming anxiety, and improving focus. One of my early teachers, David Kalin, once said to me, "Acupuncture puts us in a state of grace so the body can heal." And I've just always loved this description of acupuncture and its well-being, so please check it out if you haven't already. Like acupuncture, meditation and mindfulness practices are used in TCM to calm the mind and enhance well-being, while functional medicine emphasizes reducing inflammation and optimizing brain health through nutrition and lifestyle choices. As part of brain health and well-being, this last pillar, we offer in our clinic and on our website a mindset app to use at home to visualize the mental state you need to be in to achieve your best outcomes. I and my patients use this tool regularly to make sure we're making healthy choices and focused super clearly on how we want to live. And I recommend all my patients are clear on their health outcomes, because at the end of the day, our health and our time here is our most valuable resource. So this has been a really broad conversation on how to support the perimenopause years using the 5 pillars of health and a little explanation of traditional Chinese medicine. Our next episode will continue this series on solutions in perimenopause and menopause, focusing this time more on herbs for perimenopause. So please be in touch with us if you have questions. If you want to chat more, check out the show notes for our invitation and for lots of handouts and information on things you can do for yourself. And we'll see you back here for more solutions. Thanks, everyone.